Hi everyone, this is Abhishek Sakhara, and for my topic for community medicine presentation, I chose COVID-19. This will be a general summary of COVID-19 in the perspective of community health. I know we had a lecture on it before that focused more on the microbiological aspects, but this will just be an overview of the community health part. So for individual characteristics, the COVID-19 SARS virus is was a new coronavirus that was first identified in December 2019. Symptoms may appear between 2 to 14 days after exposure. And another characteristic, individuals who have been infected may not necessarily have symptoms. It is important to realize that those individuals are still infectious, even if they don't have any symptoms, and can spread it to other people. For symptoms, COVID-19 has generally non-specific symptoms. Here's a list that's not exhaustive, but some of the typical symptoms that we see are fever and chills, cough, shortness of breath, or difficulty breathing. People could have fatigue and muscle aches or body aches. They describe that people also have new loss of taste or smell. They could have nausea, vomiting, diarrhea, and they could also have headache. These are, again, these are not the complete list, but these are what the more common symptoms can be. So for the population-based characteristics, I got these numbers currently for when the presentation was made, which is in February 2021. Keep in mind that these numbers could change by the time you see this presentation. So currently, COVID-19 is classified as a worldwide pandemic. We see it in every continent except Antarctica. In the United States, right now there's a total confirmed of 28.3 million cases. And as far as the total deaths, we recently gone over the 500,000 mark. Worldwide, there's been a total number of cases of 112 million people that had coronavirus, and the number of deaths worldwide has been about 2.5 million at this point. Um, as we know from our lectures that a lot of people do recover, and they've estimated that our total recovered cases worldwide have been 63.4 million people. So how is it acquired or transmitted? Typically, it's from person to person, and the main way that the experts say that it's spread is through respiratory droplets. So what this means is that when a person is infected with coronavirus, whenever they sneeze or cough, what happens is like droplets land into the mucous membranes, such as the mouth, nose, or eyes, and which causes the infection. Or these droplets can also be inhaled directly into the lungs. Sometimes we see that there can be airborne transmissions. What this means is that you have aerosols, which are infectious viral particles that float in the air. And these aerosols can be breathed in by a person into the lungs to be infected. Less commonly, they say that it can be spread through contact with contaminated surfaces. So what happens in this instance is that, again, the respiratory droplets, when a person sneezes or coughs, might land on surfaces or objects. And there is a possibility that a person, after touching those contaminated surfaces, can touch their mouth, eyes, or nose. So for high risk groups, the main one has been age so far, older individuals. And for them, there's the risk factor for the severe form of the illness. And what that means is that older people are more prone to hospitalizations, being on ventilators, and also a higher likelihood of death. So the CDC reports that 8 out of 10 deaths that happened in the US were from people 65 and older. Here was an interesting table I found from the CDC. They put the risk of the severe form of COVID and made different groups of ages of age brackets to show the increased risk that different groups have. And what they did is for their reference group, they put 5 to 17-year-olds as a reference group and just calculate the rates of risk for each group. So we see that as the age goes up, there's an increased risk of hospitalization and death. The case risk stays about the same through these groups, but the severe form and death increase. So if we look at, say, 18 to 29-year-olds, for hospitalization and death, it's 7 to 15 times the increase. But when we talk about what we just said, people over 65, such as in this group, 65 to 74, that number increases from the reference group 35-fold, and then the risk of death increases like over 1,000-fold. Other high-risk groups, certain medical conditions can put people at increased risk for the severe form of the illness. This is a short list that the CDC provided. It's not a complete list, but these are what they refer to as conditions that put people at increased risk. So we have people with cancer, people with chronic kidney disease, COPD, Down syndrome, people with heart conditions can be at increased risk. And obviously what we hear before, people with immunocompromised states, people with obesity or in diabetes, but also people with pregnancy, they say can be at increased risk, and sickle cell. So for prevention and control strategies, uh, I split this between personal and then a community and a larger level. So personally, the strategies, what people can do individually is what we've been hearing from the experts over and over again. So the main ones being wearing a mask when in public. And also if they recommend that if you have someone who in your household who's infected, to wear a mask in your house as well. Hand washing is important with soap and water, and they recommend that to do at least 20 seconds. And if soap and water are not available, to use hand sanitizer, an alcoholic-based one that has at least 60% alcohol. Also, for personal control strategies, we have to avoid close contact with others. And what close contact is defined as is uh, spending 15 minutes or more with people within 6 feet over a period of 24 hours. So that's a pretty large gap, close contact. They recommend, so to avoid close contact, we stay at home whenever you can, and also try to reduce visitors in your house as much as possible. And when you do go outside, to do the social distancing, which is staying 6 feet apart from others, and also to avoid large crowds. Another prevention strategy that individuals can do is covering their sneezes and coughs, because we know that it spreads via respiratory droplets. So you can cover with tissues, or if someone doesn't have tissues, you can use the inside of your elbows, making sure to cover the nose and mouth area. And then after that, to make sure to wash their hands right away after they sneezed and coughed. So as far as the more larger control strategies, community, state, and federal level, here are some of the strategies that are being employed. First being contact tracing, and this means to identify and inform individuals who may be infected. So the way this works is usually begin with a recently confirmed case that's been diagnosed from an individual, and then to notify those in contact with that person and advise them to self-isolate to bring the numbers down. Also, testing is an important control strategies, and with everyone, but also with people who are at increased risk at work. So it's important to regularly screen and test workers considered to be increased risk of exposure. So what the US Department of Labor is defining as work with increased risk of exposure involves some of the following, such as healthcare workers and first responders, people that work in retail, people that work in groceries and pharmacies. These are what they define as increased risk. And also, we have vaccinations and immunizations as an important control strategy. And the federal government is working in partnership with state and local departments for distribution of that. And these policies can change depending on the state in which you're at. So for my concept map, this is something I drew personally. So I'll take you guys through it. It kind of summarizes the major talking points of which I just said. So we'll start with COVID-19 cases or new cases, and then the way it spreads, we talked about respiratory droplets. So when you have more of that or more people with respiratory droplets, it increases the number of cases. And as well, as we said, contaminated surfaces to a minor degree will increase the number of COVID-19 cases. So for all our control and prevention strategies, we notice that they're all focused on the way that the virus spreads. So when we wear masks, we lower the possibility of respiratory droplets, which will lower the COVID-19 cases, hopefully, as well as avoiding contact with others will lower respiratory droplets because people are not going out as much and spreading them to other people. And we have hand washing, which works with both lowering contaminated case or surfaces, and as well as after they sneeze, if they have it, lowering respiratory droplets. And those are the ones that affect in the personal. And then moving on to the community and larger levels, contact tracing and testing we use to increase the amount of people that will be avoiding contact or advising them to avoid contact, that will and which will lower COVID-19 cases. And then we have vaccinations, the new ones that came out, that this one directly impacts lowering COVID-19 cases through immunizations. This is where I would have been taking questions, but thank you for listening to the presentation.